2.
Good afternoon, and welcome to the County Executive's weekly press briefing. My name is Barry Hudson. I'm the Director of Public Information for Montgomery County. Thank you for joining us here again today. We're joined by the County Executive, Marc Elrich, and along with our public health team, Dr. Keisha Davis, Dr. James Bridgers, and Sean O'Donnell, who will be giving a health update later on in the presentation. We do have a couple of special guests today. We have Director Chris Conklin of our Department of Transportation, and we also have Captain Brian Dillman from the Montgomery County Police Department here to provide some information on road safety during the holiday season. As was indicated, reporters, if you have any questions, please indicate them in the chat. If you haven't had the ability to record, please make sure you indicate that in the chat as well. And we will go ahead and kick this off, as we always do, with County Executive Marc Elrich. So I'll hand it over to you, Mr. County Executive.
So hi, and thank you all for joining us, and thank you for the reporting crew that apparently is working between Christmas and New Year's. Thank you for coming here, spending some of your time this week, and happy Kwanzaa to those who are celebrating this holiday. We're ending 2022 on a very rough week, and there's been more than 60 weather-related deaths across the country, including 30 in the Buffalo area alone, and our sympathies go out to all those who were impacted. This intense weather is, another one of those things that, due to our rapidly changing climate, another reminder about why we have to get serious about our efforts and investments to combat climate change. This is only going to get worse, and the sooner we are able to at least put a break on the deterioration of the situation, the sooner we can start figuring out how to repair the mess we find ourselves in. But it's really important that we actually take steps to put a break on this. And it's going to take a while, not just for Montgomery County, but for the rest of the country and the world to do the things they need to do. But we are overdue in acting on it. And the time is, certainly now. More realistically, it was like 30 years ago. But now is when we are, or where we are, and that's what we need to do. We activated our cold emergency alert this past holiday weekend and encouraged people to stay at home. In Germantown, power outages made staying at home impossible for some. Our county emergency crews helped out around 36 people living at a mobile home park off of Middlebrook Road by setting up a shelter and going door to door in those frigid temperatures to make sure that everybody was okay. We also had to deal with a water pipe bursting on Christmas Eve at our respite house, which helps many of the migrants that continue to be bussed here from Texas. We had to move them twice, and we're working quickly to repair the damage. It's an incredible ordeal for a group of people that have already gone through quite a journey. Remember, a lot of these people are put on buses without knowing where they're going or why they're going where they're going, and they wind up here. The SAMU crew of volunteers and staff who are managing the respite house were just incredible, and I really want to thank our HHS and Department of Transportation teams that they were able to help out as well. And all of this is happening while the governor of Texas, shame on him, sent more buses of migrants into intentionally sent them into bitter cold weather without any idea how they'd be taken care of and where they would wind up. Some of them arrived at Vice President Harris's house in DC in t-shirts. How cruel is that for a political stunt? It amazes me that somebody who professes to be a political leader and is responsible for the well-being of people actually takes, pride in putting people's health and safety at risk. It's a pretty shameful situation, and hopefully this lunacy will come to an end at some point. This pipe burst incident at the respite house is another reminder that these people aren't political props, and the kind of reckless actions and decisions that are being made really do have real world consequences and costs. Our MCFRS responded to over 2,600 calls for service for an average of about 530 a day. Typically, they average about 350 calls a day. On Sunday, December 25th, Christmas Day, which is historically a slower, low volume response day, MCFRS responded to 624 calls, and they handled well over 200 calls alone for fire alarms and broken pipes over the 3 days. I want to thank the dedication shown by our first responders and police and fire departments, and again, the Department of Health and Human Services and the Office of Emergency Management and Homeland Security, as well as the utility crews that have helped restore services as quickly as possible. Their resolve and compassion probably saved lives even here. They coordinated with community partners like the Red Cross, which was able to make accommodations for families dealing with power outages and bring them food and offer them emotional support. This was a lot of work, but a lot of people did it, and many missing holiday gatherings on their own with their families. I want to thank again and send my appreciation to everybody who helped take care of strangers during this very dangerous and deadly holiday weekend. The cold weather has prompted several community groups to launch a coat drive for Long Branch community. Montgomery County Police Department and Montgomery County Recreation and the Silver Spring Regional Services Center are all coordinating the effort that working with the Silver Spring Cares and Cheer to collect new and gently worn coats donated by the community. Drop-off locations include community recreation centers in Germantown, Rockville, Potomac, Wheaton, and Silver Spring. The 3rd District Police Headquarters in Silver Spring is also a collection point. And the goal is to give away around 500 coats on Friday, January 6th. Silver Spring is a very giving city. This coat drive gives Silver Spring another opportunity to show what a giving city that it is. And a new report analyzing GoFundMe contributions throughout the year found that Silver Spring ranks 3rd on the list of most generous cities nationwide. It ranked number 1 in 2020. Bethesda ranked 17th on the 2022 list, and Rockville took the 20th spot. All those spots are good spots to find yourself in, and folks in those communities have a lot to be proud of. This is a wonderful way to see our community come together, and we know the community spirit will continue to be strong in 2023 as well. As this last week of the year comes to an end, it's important time to remember to give if you can. Many nonprofit organizations count heavily on year-end giving for them to make it through the year. And with costs rising due to inflation and staffing shortages, our nonprofits are more in need than ever before. If you can't afford to donate money, please consider volunteering more as a New Year's resolution during 2023. Your help is really needed. The great resignation and the staffing shortages have affected everybody, including our nonprofits. And volunteers are just critical to them being able to accomplish their missions. So to the extent that you can have the time to give, it's going to be appreciated, and it's going to do good in this community. So hopefully some of you can join the cadre that are already doing this. The main subject I want to speak on this week is about road safety for pedestrians, bikers, and motorists. Car crashes typically increase in November and December every year, but the number of people killed in Montgomery County crashes in 2022 is now near 50, up from 41 last year. For the second time in as many months, deadly crashes have killed people just walking through their neighborhoods. The latest incident happened in Gaithersburg off of Muddy Branch Road, where we have tried to improve safety. Adding safety measures alert drivers with flashing lights and prominent signs when people are trying to cross the road. But despite that, these deadly crashes continue to occur. 8 of these pedestrian hybrid beacons are now installed across Montgomery County. In the last year, we've also seen more than 5.5 miles of new sidewalks installed and seen a 15% decrease in serious and fatal crashes. We're going to continue to work on expanding opportunities to improve safety. This year, we're continuing to fund new bikeway projects and improvements where we've seen a high number of injuries. We're also engaging with tens of thousands of drivers, walkers, and cyclists about these changes and about the best ways to make roads safe for all users. You can expect our speed enforcement efforts to expand with more than 75 new speed and red light cameras coming in 2023 to slow drivers down. Drivers should remember that you're not exactly being held to the speed limit with the speed light cameras. You've got about a 10-mile buffer. And if you're going more than 10 miles over the speed limit and you get a ticket, don't blame us for the ticket. This is on you. Our Vision Zero goals of eliminating traffic-related deaths and serious injuries by 2030 is still viable, but we need everyone's help. I hope all these measures work together to make our roads safer and start reducing the number of families impacted by crashes. With New Year's weekend approaching, with much warmer weather, we have to expect there will be a lot of vehicles and pedestrian traffic, and we know there's plenty of drinking as well. Per COG data, roughly 25% of the region's total fatalities in 2021 were due to drivers being impaired by alcohol or by drugs. And the National Safety Council estimates that 408 people may die nationally from drunk driving this coming holiday weekend. It's important to take time to talk about road safety, and I'm glad that Chris Conklin and Director of Transportation and the Director of our Department of Transportation, along with Captain Brian Dillman, are joining us today to talk about our efforts to make roads safer, as well as safety enforcement efforts this weekend. So I'm going to turn it over now to Chris and Captain Dillman, and then we'll take your questions on road safety before we continue on with our weekly updates.
Thank you, County Executive Elrich. I think the executive did an excellent job overviewing many of the efforts that are underway to improve safety on our roads. And I do want to mention what a disturbing and tragic fall it has been. You may wonder why the fall months are the most dangerous on our roads. It's a time of year when we have increased storms and precipitation, increased hours of darkness when people are driving and walking on our streets, and increased holidays and other celebrations that lead to more distraction and more impairment on our roads. And we've seen the results of that this fall with many collisions throughout the county, some where the driver is injured in a crash that only they are involved in, others where people walking on the roads are injured or killed at crosswalks or other locations. I want to encourage everybody during this, the remainder of this holiday season and throughout the winter, to take a thought every time you get behind the wheel of your car and recognize the dangerous environment you're entering and the harm you may cause if you're not paying attention to the task in front of you of driving your car. I also want to encourage our pedestrians and bicyclists to use care on our roads. They are hazardous environments, regardless of what we implement in terms of engineering improvements. It is impossible to fully eliminate the hazard on these roadways, and it's incumbent upon all of us to recognize the hazards we're facing and to act responsibly when traveling on our roads through any means. We are continuing to advance our Vision Zero program through implementation of pedestrian safety devices like beacons at crosswalks. We are continuing to work to inform people how to use these properly so they can minimize the risk to themselves when they're crossing the street. And we are continuing to try to encourage a culture change among our drivers where getting from A to B as fast as humanly possible is not the goal, but getting to A and B in a safe and responsible way while taking care for others on the road is the way that we behave and operate. I want to give a note of appreciation to our colleagues in the Alcohol Beverage Services Department for their program to identify safe rides home during this holiday season. You may have seen the announcements of the coasters that they've made available to restaurants and bars that if you scan the code on that coaster, you can get information on how to get a taxi, Uber, or public transit ride home, which is a wonderful way for people to complete a night of fun if they've perhaps had more fun than they intended to when they set out for the evening. Aside from that, I'll give a little bit of time for our partners in law enforcement as we can do things to make the roads safer in terms of engineering improvements, but really the way we use the roads is the most important way that we can improve safety in this county. And I do want to note that Montgomery County is not alone in the degree of traffic collisions and fatalities we've seen this year. just last week, the Metropolitan Washington Transportation Planning Board adopted Vision Zero or highway safety targets that showed no change in the safety performance year over year. That is not where we want to go, but that's the reality we faced between 2022 and 2023. And we're hoping to make more progress in the coming year so that we can get to that Vision Zero goal. So with that, I'll hand it over to Captain Dillman to talk a little bit about the programs the police department is implementing over the coming weeks related to Vision Zero.
Thank you, Chris, and thank you, Mr. Elrich, for having me on. Just to piggyback over what Mr. Elrich and Chris have said, you know, the engineering that we have done is great, but until we are able to successfully curb human behavior, we're going to continue to have a problem. And we do, in fact, have an issue. Our fatal accidents this year has been following a national trend. We are up to 46 this year. We had a 4-week lull, and over the course of the last week, we had 3 additional fatalities, which is tragic. And the real tragedy in all this is if we focus on being sober, driving without distractions, and following the rules of the road, and that's not just for motorists, but that's for pedestrians and bicyclists as well, we could prevent these accidents from happening. And that's the heartache in all this that we see. Our latest fatal accident on Christmas Eve morning, all 3 of the major factors that we see in fatal accidents took place, and that was speed, impairment, and occupant safety. Again, all things that could be avoidable. And I just want to talk to you about just the problems that we're having with impaired drivers, and something we need to really be concerned about. We had last year in the county, we made 1,203 DUI arrests. This year so far, we made 1,089. Our fatal collisions that we've had, what we know, and some of it we don't know, because sometimes the toxicology reports aren't coming back in a timely fashion, or in other instances we might not be getting them at all. But what I can tell you is, Mr. Elrich alluded to a 25% rate of impaired drivers and fatal accidents. In Montgomery County, we actually had 27% of our fatal accidents motorists last year were impaired. This year, we are tracking at 28%. And even more problematic is the fact that a large percentage of our pedestrians that are struck are impaired as well. They are lying in the middle of the street, intoxicated, and being struck and killed. So as a result of that, one thing that we're doing, and we've done consistently each year, is we have a holiday task force that this year consists of 52 different officers over the course of 8 weeks, from November 9th to January 1st. We'll be participating in that. We're very fortunate in this county. We have a lot of allied agencies assisting us, to include Tacoma Park, Rockville City, Gasburg City, the Montgomery County Sheriff's Department, Maryland Department of Transportation, Maryland State Police. They're all assisting us in this effort. And just to highlight their efforts this year so far, they've made a total of 251 DUI arrests so far this year. They've issued 2,184 traffic citations and another 2,184 stops, which resulted in 2,680 traffic citations and another 2,099 warnings. What's also very concerning is, despite the fact that October 1st, we had the move over law that was expanded, that went into effect. And of the, during the task force, we've had 33 DUI related crashes, of which 5 have involved Montgomery County or allied agency police crews that have been struck in the performance of their duties. Now, this isn't police cars that are parked. These are police cars that are actually making traffic stops. And in one situation, we had a burglary, an officer that was on the perimeter of a burglary call, who was occupied in the vehicle and was struck by a DUI driver. All 5 of these incidents involved intoxicated drivers. Fortunately for us, only one of those cruisers was actually occupied at the time, and that was on the burglary perimeter I was telling you about. That officer, unfortunately, was transported to the hospital. He is going to be okay and was released. But we've got a major problem with impaired drivers. And as you know, and Chris alluded to it, there's just absolutely no reason for it because we do have a robust rideshare program here. We even have incentives to get the rides, I think, for $15 if you are impaired. So our holiday task force has done a phenomenal job. They're out there. And I would argue of the 251 arrests they've made in the first 7 weeks, that's a small fraction of what's actually going on out there. There's a lot more drivers out there that are impaired. So that just kind of highlights some of the things that we're doing now, but we just need to get the word out there to be sober, whether you're behind the wheel, whether you're walking and a pedestrian or a bicyclist, we're seeing a lot of level of impairment, whether you're walking, riding a bike, or driving a car. And then just for pedestrians, using those crosswalks, using the signals. We're very fortunate here in Montgomery County that we have pedestrian signals, and a couple of the last few fatal pedestrians struck, we have early indications that the pedestrians may not have been in a crosswalk despite the crosswalk being very close. They may or may not have activated a pedestrian signal that was in very, very close proximity. So all these little things that could literally save a life, we've got to change the human behavior element of it.
Thank you, and Captain, if you could move back from your camera a little bit more, so we can see. Yeah, there we go.
Sorry about that.
That's okay. All right, we'll now open the questions up to media. If you have any questions for this particular topic, which would be road safety. Any questions from the media for this segment? Okay, we'll move on to the public health piece, and we'll hand it back to you, County Executive. You're muted, sir. You're still muted.
Goes over there.
Oh,
Okay.
there you go.
Better. Okay. I wanted to thank Chris and Captain Dillman for joining us. We're going to start on the health update. This week, we continue to intensely monitor the COVID-19 situation. We know that we won't get as accurate a gauge of what's going on in the county now as more people have returned home, until more people have returned home from their holiday travels. So we expect a delayed reaction to what people may have encountered on their holidays to show up after the first of the year. Our COVID case counts and hospital patient counts continue to climb, keeping us at medium risk when we're looking at COVID-19 community levels. That's a significant increase from what we were seeing last month at this time, but significantly lower compared to this time last year when the Omicron surge was, really building. And however, January will continue to see, as we've seen in the past 2 years, very likely further increases in these numbers. It's why the public health advisory issued before the Christmas holiday by the county health officer, Dr. Keisha Davis, is very important. I encourage you to still follow the guidance we've been sharing for months now. Wash and sanitize your hands and use caution around those who have serious health risks and could, encounter serious health complications due to COVID-19. I encourage you to remember to wear a face mask if you're in indoor crowded places or nursing homes, to stay home if you feel sick. Don't find out you've got COVID after you've been circulating in public for a while, and go to your primary care physician or urgent care to treat symptoms. Remember, there's a high number of flu cases sending people to the hospital right now as well. Testing yourself is another way to keep our community safe. Positive tests should be followed by a minimum of a 5-day isolation period tests. Montgomery County is committed to offering free COVID-19 tests through the pandemic. We're going to continue moving forward. We do ask you that you limit how many tests you pick up for free at our libraries and other locations. Before the holiday, there were reports of some people hoarding tests and taking them for distribution from distribution sites in large bunches. Please know that the federal government's once again giving away 4 free COVID-19 tests by mail if you sign up online. Being vaccinated and up to date on your bivalent booster shots decreases the likelihood of having to deal with a serious case of COVID. Before I bring in Dr. Davis and Sean O'Donnell from the Health Department to talk more about our ongoing health threats and take questions from you, I want to acknowledge 2 other things that have happened. Today is the last media briefing that Jim Graham will be a part of here. He's the lead engineer in our public information office and plays a key role in all of our broadcasts here in Montgomery County on Montgomery County Cable. And this media briefing each week is a part of what he does, and I wish him well in his retirement after 23 years with the county. Thank you so much for everything you've done for us. And finally, Montgomery County's Muslim community and our whole community lost one of its leaders earlier this month. Dr. Akilur Rahman was a founding member of the Montgomery County Muslim Council and the Montgomery County Muslim Foundation. He was a community activist. He was an advocate, not just for Muslim issues, but for community issues. One of my, my first encounters with him was a long discussion about school achievement and what we could do to raise achievement for our youth, particularly minority youth who can be seen as struggling in our schools. And he was very concerned about that. He was also a leading cancer researcher. And his work made a dramatic impact both at home and in the world. And my condolences go out to his friends and family. And I was happy to be part of a ceremony that was held for him this weekend. And I wish his family well. And I do offer my condolences for their loss. And with that, I will turn this over to Dr. Davis and Sean.
Go ahead, Sean, we'll let you kick it off.
Okay. To take you through some of the, again, just a little bit deeper dive into what we're monitoring in the county. We have seen very high levels of hospital visits, emergency department visits, while we're at about 48% of the total hospital visits that we saw this time last year. There's still a lot of opportunity. It's still higher than any point since Omicron last year. And there's still a possibility that this continues to go higher as we go into January, as it has the last few years. What we're seeing is the levels of respiratory disease with our younger folks continues to decline, while our older populations now are the ones who are transmitting these respiratory diseases, mostly COVID, but also influenza. Looking at how our cases, our county executive shared our dashboard view, we saw a little bit of a dip this morning. That's likely because there's a lot of people who over the holiday weekend and even into Monday decided to use rapid tests that aren't captured here versus going into a healthcare facility or other place where they got a PCR. But what we've seen across the East Coast is continuing rising rates before the holidays. We expect they're continuing to go up. New York is about double what we're seeing in places like Philadelphia, Boston, and the DC metro area, including Montgomery County. But looking at those rates, we do expect our rates are likely to continue to go up post holidays. Just to identify those key points that were in the public health advisory that Dr. Davis put out just before the holidays, was the use of a well-fitting mask during visits to congregate places and other public places with limited social distancing, the use of testing and test to treat antiviral medications after returning from travel or gatherings, and just strongly urging everyone to make sure they've gotten that bivalent vaccine booster and their annual flu shot. This came out just prior to the county officially going into this, passing the CDC's community level of medium. And just to remind our community that at medium levels, the CDC recommends very similar things to what HHS has been advocating now for a little bit, wearing a high quality mask. Those individuals who are at high risk for severe illness should wear a high quality mask when indoors in public settings. And those people who could have contacts with individuals who are at high risk, whether it's in their household or a social contact or going to visit someone, consider testing before going to visit them to make sure that you are not asymptomatic or possibly going to infect that person at high risk. And please consider wearing a high quality mask when indoors with high risk people. We are tracking the variants. You can see the forecast from the CDC for our region continues to show more and more of these subtypes of BA.5. Not a significant change in what we're seeing here. Again, you can see from our graph, the light shaded numbers here are the totals of hospitalizations, including the alternate care site, and we're at a higher total now than any point this year, going back to the Omicron spike last winter. The deaths continue to increase slightly. We're not yet at the end of the month. We'll likely be in the mid to upper 30s in Montgomery County, showing that this is still a deadly disease, unfortunately, that is just spreading to our community. And as you can see, there's a national increase in deaths attributed to the range of serious respiratory diseases. Just a reminder that that there is a difference between hospitalization rates and death rates for people who are vaccinated or who are not vaccinated or who are boosted. And we continue to share this data on Montgomery County rates. You can see even that first chart for hospitalizations, we don't have data on the boosted numbers at hospitals. It's not collected per CMS, but you can see people who are just fully vaccinated, that rate has even gone up some for hospitalizations. Whereas you can see for death rates, those who are boosted remains very, very low. So again, that booster is a critical piece of protecting yourself. Moving on to RSV, just consistent with previous weeks, we've really seen those cases decrease quite a bit over the last few weeks. And within influenza, again, the story of influenza is that it hit the nation in our area much earlier. At this point of time in the calendar year, over the last 10 years, we have not had this much influenza at this point. However, for the total year season, we haven't quite hit some of the previous highs. If the influenza goes down significantly, maybe we won't hit those highs, but we've had a lot of early influenza. We've had the number of flu hospital admissions nationally decrease now for 2 weeks, which is an encouraging sign. But you can see the total influenza positive tests still very high, even though they're starting to come down. The graph on the right is last year's influenza to scale with this year's. So you can see the peaks of last year's, which were about 7,000 positive tests reported to CDC, way lower than what we're experiencing this year. This is the Maryland influenza report. We are seeing again in Maryland that come down a little bit over the last week or so, and hospitalizations have come down in Maryland as well with influenza. COVID continues to make up the majority of these sorts of respiratory serious illness. The deaths in Maryland are up to 21 related to flu. And finally, with RSV, we're happy to report no new cases now. This has gone for several weeks with no new cases. The level of activity across the United States, in a case or two in Maryland. We're still providing vaccinations in the county. So if you believe you're at risk, please contact us and we will help to get you a vaccination. Now I'd like to turn it questions if there's nothing to add from Dr. Bridgers or Dr. Davis.
Nothing from me, Sean.
No, nothing additional. The only thing I think, just reminder about how effective the bivalent booster is, and that if you haven't gotten it yet, to get that. It's now approved for everyone 6 months and up. So take advantage if folks have extra time over the holidays. Most of the county vaccination sites are open during this time and are operating on a holiday schedule. So take advantage of that little bit of extra time to get that booster for the flu and for the bivalent COVID booster.
Okay. Thank you, public health team. Any questions? Do we have any from the media? We do have one from Steve. Steve, go ahead.
Happy holidays, everyone. Yeah, Sean kind of got into this a little bit, but if we expect the numbers to kind of track up like they did this past January and the year prior, just around this time of year, when does this get concerning, I guess, frankly? Is it as we see things go into like the moderate ranges of all those metrics on the dashboard? I guess my first question is just kind of that broad level. When does this kind of get concerning from a hospital capacity and just kind of public health perspective?
I'll just add something that we haven't shared in this report, but we do track data from our fire rescue services and our EMT providers. They have software that gives them information about how long their units spend at hospitals, and the length of time that our units are at hospitals waiting between arriving and unloading a patient has risen over the last few weeks. And that prevents that limited resource from getting back out there and being available. The more EMS units we have on the streets, the quicker they respond to calls, the shorter time from arriving in a hospital to moving that patient to a hospital bed, the longer they're getting care from EMS provider versus a hospital provider. So those are concerns we have right now. And some of it, when we look at the absolute numbers of hospitalizations, we want to remind you, it's not always the same from year to year. Our hospitals have been reporting decreased staffing, as everyone in healthcare has felt, as people have gotten burned out and we have fewer positions filled at these facilities. So it is, especially when you have an event like this, which is not a surge for a couple of days, but it's for weeks and weeks and weeks. So we are concerned that at this point, it's not that we're running out of hospital resources, it's that it's taking longer for patients to get into them. And so again, we're telling this to people because we want to reduce the serious illness. We want to reduce people who need to go to the hospital or become inpatients at hospitals.
And so, Steve, just to add, last year this time we increased our conversations with our hospital partners, and we had daily meetings, if you will. When the ICU and the acute care units became filled, we began to look at resource staffing and issues and challenges, not only with the hospital occupancy with the beds, but also the resources and their staff being vaccinated. Our team have had conversations. We continue to have conversations with not only our hospital partners, but our congregate settings as well, our correctional facilities, our assisted living facilities as well. So all of those factors come into play when you think about, when does it become alarming? It's alarming now. We've had conversations with our county executive who raised some concerns we know that we anticipate a post-holiday surge. So we began for this planning early on in the month and increasing those conversations. And so Dr. Davis, as soon as she came aboard, recognized the need and issued a public health advisory. Not a warning, but an advisory that, hey, those are those things that she spoke about earlier in her remarks as far as getting updated. The bivalent booster is available. So those systems we continue to monitor. And as we return from the holidays, we will increase that monitoring to make sure that we have the sufficient notification and information out in the public domain.
And Sean again kind of alluded to this, and maybe I'm just not looking in the right places, but how much is the flu and RSV contributing to healthcare capacity and kind of just general issues versus just COVID, given that this winter's a little bit different than years past?
I mean, it's certainly much more significant this year than we've seen in the past, and we've shared some of that graphs. For time, I don't show you all the graphs that we're looking at, but virtually no RSV, virtually no influenza in the past 2 years compared to previous years. But that said, when I say there's 21 deaths so far this year, or this flu season to influenza across the state of Maryland, and we have, I think it was 32 deaths in Montgomery County alone in December for COVID. That gives you some perspective of the differing impact of the two.
Do you have the local, in terms of flu deaths, do you get that locally, or is that, because when I look at the state, I just see high spread of the flu, and I'm wondering how that works out if you guys have the data, frankly.
We don't. When it's a very small number, the state tends not to release that jurisdiction by jurisdiction unless the number is greater than 10. And that it's a complicated rationale, but a lot of it comes down to some of the smaller jurisdictions where there's a single healthcare facility. It may violate HIPAA by releasing that sort of data. In our jurisdiction, with many hospitals and a huge population, it would be very difficult to know who those individuals were, but the state has a policy. They don't release it if it's lower than a certain number per jurisdiction.
That's interesting. Have you talked, I guess it's hard to kind of single you all out to get that data if it wasn't the HIPAA violation that you're kind of describing?
I do think it's something that our EPIs could likely pull out of the disease database to look at. But again, these are very small. These are likely very small numbers when we're talking, 21 over the course of several months in the state.
Compared to COVID, yeah.
Yeah. We certainly do, because the numbers are much higher for COVID. We're certainly looking at that even month to month within Montgomery County. And
then just kind of a broad overarching question, just preparing for, like you said, the surge we might see in the coming month. I've asked this a million times, you probably won't tell me a magic number, but a mask mandate instead of a, recommendation, and kind of other measures that are put into place. When does that become more likely of something that's put on the table?
Well, again, I'll kind of share what I did I think a week or 2 weeks ago when this was asked, and it's to just remind folks that there are masking requirements in certain settings where there's outbreaks going on and where there's high risk individuals. Those are some of our congregate living settings. When outbreaks are identified, masks become required. Testing is required in some situations in those settings. So they each have different playbooks and responsibilities according to CMS guidance, state guidance, and how we implement it locally. But I think you're asking about a general public-wide mask mandate. And what we've identified over the past year and following the CDC guidance is, if our hospital space is not, and capacity is not threatened by that level of transmission, it becomes a strongly encouraged versus a mandated thing for the public, because we're not seeing we're not seeing as many individuals at this point become hospitalized, even though transmission rates are much higher than they have been in the past.
And just real quick, I just want to double check with the county executive. I know he has another engagement, and I want to make sure if he wanted to have a last word or so before he left, he had that opportunity.
I'm okay. I'm okay so far. I can stick on for a little bit.
Okay, great.
I actually, if Mark is available for questions, these are on public safety. I don't need to tell you, Mark, about some of the incidents that have happened in the past month just being horrific. And I just want to give you a chance to kind of, you've done a lot of policies, you've increased police pay. I just want to give you a chance to kind of analyze how you think that's impacting what's going on right now. Obviously you've done a lot in the public safety realm, and just kind of, do you think it's enough? I mean, what could be done moving forward, I guess? I guess it's a long-winded question, but I'm sure you get what I'm getting at.
Look, I mean, you're posing a really difficult question that if anybody had answers to it, we would have solved this stuff a long time ago. We've, obviously increased resources that we're putting in areas where we know we have issues. If this were, if we weren't talking in the context of last week, we'd be talking about, well, there's been a marked decline in some of the things that, we were looking at. So, we can say that to some extent that the efforts we've made have been effective. But then all it takes is one horrific incident, which wipes out any perception that the things you've done have been effective, because the incident is truly horrible. And, people get shocked by it, and it kind of, blanks out everything else. So it's a little comfort to people to say, in general, things seem to have gotten less violent and less combative, and then have an incident like what happened like last week happened. We're going to, do everything we can to find the person. We'll continue to, maintain the monitoring levels. You see cameras in Silver Spring, which we never had before. We're doing things in there in Silver Spring that we never thought we'd be doing, but we're doing them because they need to be done, and we'll keep doing them because they need to be done. But, in this last instance, I don't know any way that one could have prevented this except for having a police officer in every stairwell, in every garage and building in Silver Spring, and that's likely not possible. So we've got to try to identify things as quickly as we can. We've got to try to, suppress what we know to the greatest effort possible. And we're going to continue to push and do everything we can. Resources aren't an issue. We've not told the department, we'd like to do something, but we don't have the resources to do it. So we're going to keep doing everything we feel like we need to do. And
I would say, sir, that homicides are down this year, but it's been reported that crimes against people and property have actually ticked up. So what are you going to do? I know I've it listed what has been done in terms of police reform, to use that phrase, but what are you looking to do in the coming months, especially in the Silver Spring area? I think a lot of people are concerned.
Well, I mean, one of our big challenges has been, the staffing levels in the police department. And the good news is that our recruit class has gone up, most likely because, we finally increased the pay, which is something I tried for years to do, to make it more competitive. And so we increased the size of the force. But, we are caught in a situation where every time, we have incidents like this and we heavy up in a particular geographic area, those resources are coming from other geographic areas. So it creates a challenge, which is why we need to get the police department back to being fully staffed as soon as we can accomplish that. And that's, that was our goal in raising wages. It's why we've got a larger recruit class. We're actively trying to recruit people from existing departments, so the training process is long, and we're going to continue doing that and get this force back in terms of size to where it belongs as quickly as we can. They're also doing an analysis of the county in terms of whether we should add another police district to the structure, which would, I think, help us spread the load better and make sure resources are deployed more evenly. So you can look to us to continue to work at everything we can and everything the department can to, bring about different outcomes. And
Outside of kind of the manpower and kind of issue just broadly described, what else do you think can be done, I guess, to address this, broadly speaking?
I don't know how you address, having adequate patrols and using patrols as a deterrent unless you solve the manpower problem. I mean, you need people and resources to solve this problem. We can put more cameras out there. We'll likely wind up putting more cameras out there. But, you know, cameras are better at producing evidence than they are at stopping a crime unless a person realizes they're on camera and, you know, has a sense that, you know, I don't want to do something in the view of a camera. So that's something we can do without increasing personnel, and it's something you're likely to see us increase doing. You know, we're dealing with a lot of individuals who obviously feel disconnected and seem not to have much stake in society the way many people think about how one reacts or acts within a society. And unraveling that and getting to what the underlying causes are, you know, I could give you, you know, simplistic, broad answers, but actually getting down to the community level where you're actually able to help people, reach people before they, you know, dip into this end of the world of violence and, you know, and crime. That's a hard thing to do. And it's, there's no clear path on how you get there. But it's,
I'm sorry.
you're not going to stop it with police alone. You're going to have to change behaviors, and just increasing police officers doesn't change behaviors.
I'm sorry, I'm behind on the new police district you were mentioning. Is that splitting up one of the current ones, or where that might that be? I'm sure it's still.
We'd rebalance all the districts with the goal of creating more even loads and more even policing resources across the districts.
Thank you very much.
Okay.
Thank you, Steve. Thank you, Mr. County Executive. Are there any more questions? Okay. Being none, want to thank everybody for joining us today. I too want to give Jim Graham a shout out for his great work over the last 23 years. He's been an amazing support to our department over the last few years. You know, thank you, Jim, for all you've done for those few 23 years that you've worked here in the county. So with that, we will call it a day, and in advance, Happy New Year to you, reporters, and we'll see you again next in 2023. Thank you very much.
Thank you all for joining us today.